Hi, Colin. Thanks for being here.
Hi, good morning. Can you
Hi.
hear my audio okay?
Yeah, that sounds good. Eileen Scully will be here shortly and she'll introduce you, and we usually get started a few minutes late.
Great, thank you.
Okay, see, oh, and there she is.
Hi. Yeah, I'm always leading the lateness. So usually we start right at 12:04 because there's like a bunch of people who join sort of between 12 and 12:04. Thank you so much for doing this. We're excited to have you.
Yeah, of course. Thank you for inviting me.
Um, and then once these slides come down, you can try to show your screen and see how it goes. And I have looked you up on the Osler website, so I will introduce you based on that bio if that's okay, unless there's anything wrong.
That'll be fine.
Okay, great. And then are we going to be able to recruit you actually into ID? Is that actually feasible?
Yeah, I'm very excited to be applying in just about 2 weeks,
Awesome.
which kind of time flies.
Yeah, right. It's fast and slow during residency.
Yeah.
I'm on Polk in 2 weeks or 1 week. Well, 1 week.
Oh, that'll be so great. I managed to get 2 extra blocks of Polk this coming year as a SAR, so I feel spoiled.
That's always the that you've hit the jackpot as the attending when you've got a SAR there, because you're like, not only are they a SAR, but they actually wanted to be here, which is, always makes things go even better. So do you want to try and share your slides? Great, that looks great.
And Dr. Scully, is what you're seeing the actual slide itself, or do you see the presenter view with all of my
We
notes
see
and
no notes,
paraphernalia?
no secret stuff, just the right view.
Good. All right.
Yeah.
That's good. I'm post call today, so um so if my brain skips it all, that's the reason why.
Got it. Well, again, thank you for doing this. Hopefully you did get a little rest this morning.
I did, and I had done this presentation once before, and it was a great bit of fun, honestly. So I was looking forward to the opportunity to do it again.
Yeah, and it was actually during this meeting, which was why so many of the people who come to this meeting were not able to be there. But Natasha had said, "Oh, it was so good. You have to have him come and do it." And I was like, "Okay, he's willing. We would love it."
Great.
Okay. All right. Well, so as everybody is joining, I will just a couple of quick notes. So welcome to our Friday Center for AIDS Research Clinical Conference. And before I introduce our speaker, I'm just pulling up for, sorry, I don't actually have the schedule for the next couple of weeks, but I think next week is a case discussion, if I'm right. Is that right, Laura?
Yes.
Okay, perfect. So please join us next week for a case discussion. I know that Sonia already has one. And so look forward to that. But for all of those of you who are, and then we will be taking our summer break in August, just as a preview of that. And probably the first thing we'll have when we come back will be a review of IAS. And so if any of you are going to IAS and you want to participate in that review, please let me know. Otherwise, we'll do our best to provide some highlights. Okay, so it looks like we have reached sort of critical attendance mass. So I will introduce our guest speaker today. So we have with us Dr. Colin McLeish, who is an Osler resident, rising SAR, grew up in Vermont, attended Swarthmore, and then the Geisel School of Medicine, and also the business school at Dartmouth, if I'm correct. And then did a consulting with the Boston Consulting Group, ultimately, specifically in thinking about global health, and then we were fortunate enough to recruit him here to the Osler residency, and also looks like we're fortunate enough to recruit him to the best specialty, which is infectious disease. So he did this lecture previously as part of a residency program, and I got so many positive notes from it, and was actually during this conference, so many of us couldn't attend. So we were really grateful to him for repeating this presentation here today on Dr. Frank Polk. So thank you so much, Dr. McLeish. And I will, hopefully I'm saying that correctly. And I will hand it over to you.
Okay, thanks so much, Dr. Scully. And the way that I have my view set up, I actually can't see myself or anyone else. So if anything is to go awry, maybe just drop something in the chat. Am I coming through okay on the audio?
The audio sounds great, and I will unmute and let you know if something goes off.
Great. Well, good afternoon. I'm Colin McLeish. I am a rising SAR in the OSER program. I have about a week left until I become the senior on the team. I see a lot of, or at least before I shared my screen, I'd seen a lot of familiar faces in the ID division. More may have joined as well too. But it's so nice to be with you all this afternoon. I have the pleasure of sharing a presentation today about the life and legacy of Dr. Frank Polk. He's one of the most preeminent authorities on the epidemiology of AIDS, and certainly an important figure in the history of Johns Hopkins as well as the history of infectious disease. And I had the advantage of giving this presentation once before to an audience of Osler residents who knew Frank Polk mostly by name and single associations with the field of HIV. This audience today may know a bit more, and I think there may be some people on the call who had known Frank Polk at some point in their career. So it's really a joy to use the hour today to share more about the rich history and legacy of his life. And with that, I'm happy to jump in. So today we're going to cover the life and legacy of Frank Polk, and at the bird's eye view, he was a very prolific scientist um, um, as well as a very important figure at Hopkins and in the field of infectious disease. Um, he ended up publishing over 90 scientific articles, co-author of 11 books and monographs. He was the PI on two incredibly important studies in understanding the epidemiology of AIDS, one of which was the multi-center AIDS cohort study called MAX, the world's longest running AIDS cohort study. He was pivotal in establishing the AIDS outpatient clinic at Johns Hopkins, co-founded the AIDS inpatient unit at Johns Hopkins 2 years later. We'll also talk about the life of Frank Polk too, some lesser known history. He was a veteran of the Army Medical Corps and a conscientious objector, husband and father of two. I'm going to move chronologically through Frank Polk's life, starting at the beginning. Frank Polk was born in the central west Texas town of San Angelo in 1942 to parents Fay and Marion Polk and one older brother, Ed Polk. His mother, Fay, was a middle school teacher, and people close to her had referred to her as a force of nature. And it was true that Frank was raised by a Texas woman, and those close to him knew that what he had gotten from his mama. He was a graduate of UT Austin in 1963, 1 year prior to the passage of the Civil Rights Act. Was fortunate enough to speak to a lot of people close to Frank, including Bud Frazier, who attended both medical school and college with Frank Polk, and who spoke brilliantly about his compassion as a humanitarian, in addition to his legacy as an investigator. Shared a story about how in 1962, Frank had on campus worn a symbol on his jacket of black and white hands clasped in a handshake. And in 1962 in Texas, nobody had the courage to do that except Frank. After college, Frank Polk went to medical school at the Baylor College of Medicine in Texas. where he would famously tell a story about scrubbing into the operating room with the famous CT surgeon, Dr. Michael DeBakey, of a memorable moment where, in the middle of the procedure, Frank, as a medical student, would drop a retractor on the floor of the OR. Silence filled the room, and Dr. Bakey said to him, "Son, you're either stupid or not paying attention. Which one is it?" And Frank Polk was paying attention, perhaps to other things that were drawing his focus. Spoke to Tony Herring, who described himself as Frank's roommate and best friend, about an important story of them in medical school. Um, there was a time when all medical students were obligated at the Baylor College of Medicine to purchase stethoscopes, ophthalmoscopes, and otoscopes from the school. And Frank was particularly incensed over the prices that the school was charging. Um, Frank took it upon himself to call up the companies who made all of these medical devices and find the wholesale prices. Told his roommate at the time, Tony Herring, that they were forming a company that would eventually come to wholesale all of the stethoscopes purchased by medical students at Baylor, where he sold them for a 10% markup to cover their time and commitment. And they did that for all 4 years they were at Baylor. And Tony Herring had reflected that if you knew Frank, you knew it was not about the money. It was about fairness, and fairness was personified by Frank Polk. So Frank leaves Texas after graduating medical school and starts his internship at the St. Luke's Hospital in New York City, and would also do his jarship at the New York Hospital, which would become part of the Cornell medical training program. One of his co-residents at the time at Cornell, Dr. Sidney Block, um, famously recalled in the first time that he met Frank Polk, Frank introducing himself as Billy Frank, and Sidney Block had said, "Is that what the B stands for, Billy?" Frank replied, "Yep." And Block pressed him, "For real, not a nickname, Billy Frank?" "Yep," he replied again. And his co-resident at the time thought, "Oh boy, he better stick with the B up here in New York." Um, Despite that, in December of his JAR year, Frank meets a sophisticated young woman at a Christmas party named Kathleen, who would fall in love with this Texas man and later become his wife. Frank was drafted for military service out of his JAR year. And by the Vietnam era, the Army had begun planning a more modern hospital and ends up opening a 10-story, 550-bed facility in 1969, the Letterman Army Hospital in San Francisco. Frank is drafted into service. He famously recalled a story of when he was first drafted to the hospital. When he was given his assignment, he ended up serving in the dermatology division, despite being trained in internal medicine. And one of his unit coordinators at the time had said that he had went easy on Frank because he was a fellow Texan. But despite that, and despite the relative ease of his assignment, Frank was very morally scrupulous of what was happening in the larger world, especially around war and in Vietnam. And um, in um, in 1970, Frank becomes one of the 170,000 conscientious objectors of the war, um, and is able to leave the army and military service. So he ends up returning to residency, this time in Boston, to complete his SAR year at the Brigham Hospital. where he is serving under Eugene Braunwald, the chief of medicine and former Osler House staff, where Frank really became a standout in his residency class. He earned the highest marks on his evaluations by faculty. And in some of the comments that I was able to find in the medical archives, he was described as a leader among medical residents. One instructor said he noted Frank's 4+ maturity and stability. We weren't given a scale on that, but we can infer that those were high marks. An excellent overall resident. And with this additional praise, after residency, he starts infectious disease fellowship at the Harvard Channing Lab in 1973. I think the closest analogy that we have to this today would be a fellowship at the NIH, where fellows work in a lab and then rotate through several hospitals in the area. Frank rotating through several hospitals in Boston. And he earns his master's in epidemiology at the Harvard School of Public Health and begins to take an interest in disease epidemiology, and in particular starts focusing on obstetrical infections as well as cardiovascular disease, and forming a network of connections with co-investigators around Boston. If this goes to show how small of a world the field of ID can be, this was my research mentor in medical school, Dr. John Maudlin, who was one of Frank's co-investigators in Boston, ended up reuniting with him at Johns Hopkins later in their career. John Maudlin had told me that Frank was a natural-born leader whose intensity and enthusiasm inspired others. He was a person who was deeply devoted to his family and to his calling, and he was a fierce advocate for his patients, his coworkers, and for his beliefs. And who had sadly said he'd often reflected about how he accomplished so much during a short career, and thought what greater impact he would have had if his life hadn't been so cut short. He also loved their regular Friday squash matches, followed by dinner out with family and friends in the Baltimore area. So after finishing infectious disease training, Frank Polk becomes junior faculty in Boston and holds several hospital appointments, culminating in an associate professorship of medicine at the Brigham and Women's Hospital, where he's overseeing some of the fellows, and also having a trail of several interesting cases, one of which was a patient at the New England Aquarium who had been bitten on her hand by a seal. And at that time, the lore of the aquarium was that seal bites should be treated with erythromycin, but there wasn't great evidence to make these clinical decisions. Frank had a young woman who had been on erythromycin for about 5 days when her hand became increasingly swollen and painful, and the infectious disease was engaged. I spoke to Dr. Richard Markham, who was one of Frank's infectious disease fellows at the Brigham, who had recalled how no one had ever treated a seal bite before. And as Frank had explained it, erythromycin would just not be as effective. And so Frank had found an obscure Scandinavian journal that had made one other case report about erythromycin. And the great part about this case was that when the primary team had switched the patient off of erythromycin and to a different antibiotic, penicillin, she had been discharged home. Frank had called this patient at the aquarium and found out that she'd actually gotten worse after discharging the hospital, and then went to her home to start her back on erythromycin, and had found out that with the treatment course of erythromycin, the response is very slow, and ended up salvaging her finger. Dr. Richard Markham had said that he really remembered this case for three reasons. First was because they didn't get a lot of seal bites admitted to the Brigham. The second was because Frank had called and visited the woman to see how she was doing, even though everyone thought that she was cured. This was not standard of care for most infectious disease faculty. And the third was because of all the times he had been an infectious disease fellow at Harvard, Frank Polk was the only one who had said, I was wrong, and gone back on their plan and did what was best for the patient. He reflected that it was never about Frank. It was about getting the job done, solving the problem, healing the patient, taking on the epidemic. No posturing, no self-aggrandizement, and also very little tolerance for those who did engage in such activities. Was the model for the rest of us. And coming from another Texan, it was West Texas at its best. And they end up writing up the case. So Frank did demonstrate a great bit of foresight during his years as a young investigator, turning his focus towards infectious disease epidemiology, which was resurgent during the 1980s. Um, Jonathan Semet had worked with Frank Polk in the Channing lab, who had commented that Frank was another leader who anticipated the future directions of the field with great accuracy. And in Frank's own words, he was beginning to recognize trends that were emergent in the early 1980s in the field of infectious disease. And one commentary that he gave in the Baltimore Sun, he reflected on his first encounter with a patient with AIDS that occurred 2 years before the virus was identified while he was teaching at the Brigham. It was late 1981. I saw a gay man with chronic diarrhea and cryptosporosis. I said, I wonder if that strange new disease I wonder if this was that strange new disease that was recently reported. And by the time I got to Hopkins, I had a sense that this disease wasn't going to go away. He said for the Hopkins Bloomberg Public Health magazine that he realized that the first few cases of AIDS were only the tip of the iceberg and how important the disease would become and how challenging research and treatment would be. So this chapter of the presentation is about Frank Polk at Johns Hopkins from the years of 1982 to 1988, right up until his early death. This here is going to be familiar to many people on the call about the timeline of the AIDS epidemic, but it's a good review because it shows how Frank Polk situates directly in an unfolding infectious disease epidemic. In 1981, there were case reports of uncommon cancers and infections among men. It was first described in the literature as gay-related immune deficiency, or GRID. In 1982, when Frank Polk joins Johns Hopkins, there were the first documented cases of AIDS that were contracted from blood transfusion. In 1983, investigators in France isolate HTLV from a PCR of a lymph node sample. And in that same year that investigators were just beginning to get a sense of the virology of this disease, Frank had begun recruitment for what would become one of the largest studies to understand the epidemiology of AIDS, which was the study to help end the AIDS research effort called SHARE, which would transform in 1984 to the MAX study, the multi-center AIDS cohort study, as Frank's work was recognized among 3 other NIH-funded research sites as some of the most important trials occurring in AIDS epidemiology. In 1985, there's the first ELISA test for HIV IgG, which was designed to screen blood products. And then in 1986, Surgeon General Everett Koop was appointed by Ronald Reagan among a cabinet of religious conservatives, famously defied politics and declared AIDS an American public health crisis, famously said, we're fighting a disease, not people. And then in 1987, 1 year before Frank Polk's death, the FDA approves a thymidine analog called zidovudine to treat HIV infection. It's the first time there's a treatment for HIV 6 years later after the first case reports. I want to show a video right now of Dr. Tom Quinn about getting Frank Polk to Johns Hopkins.
I'm Tom Quinn. I've been with Johns Hopkins since 1981, and I'll come back to that because that's how I originally met Frank Polk. Currently, I'm a professor of medicine in the Division of Infectious Diseases, and I direct the Center for Global Health. I'm the founding director of that center. It's a university-wide center. It's not based in any one department, but in all the schools. And so I arrived at Johns Hopkins in 1981, July of 1981. And it was during that time that both John and I and people in other cities were starting to see gay men coming down with very unusual opportunistic infections, cancers, a whole variety that all of you have had to deal with, but we didn't know what it was at the time. And for 6 months, it didn't even have a name. But after we saw that this was an epidemic, it was named by CDC as the Acquired Immune Deficiency Syndrome, or AIDS. It was invariably fatal. There was no treatment, and we didn't know what the cause was. So there was a lot of unknowns circulating at the time, and yet it was killing very young men fairly rapidly once they were diagnosed with the immunodeficiency and the opportunistic infections. And so we started studies, but along the way, just about 10 months after I had arrived and was working on a couple of these cases, trying to figure out what's going on, Frank Polk was recruited primarily to the School of Public Health to actually get more engaged in this mysterious disease.
And Frank was really there at the beginning. And so in 1982, John Bartlett, the then chief of infectious disease, recruits Polk to the Department of Epidemiology at the School of Public Health. John Bartlett had become the chief of ID in 1980, 2 years before, and the division of ID at that time at Johns Hopkins was small, with only 3 faculty members. John Bartlett had known Frank from Boston when the two had formed a relationship at that time. And after arriving in Baltimore, Frank begins to follow case reports of clusters of pneumocystis pneumonia, atypical mycobacterial infections, and Kaposi sarcoma among men in the Baltimore area. John Bartlett had clearly remembered the day in 1982 when his friend and colleague Frank Polk had walked into his office and announced that he was going to change the direction of his career from focusing on the epidemiology of obstetrical infections and cardiovascular disease to pursue a new disease, to which Bartlett replied, "What disease? There are 7 patients." And then Polk had responded to him with great foresight, "This is going to be a big one." Here's an overview of the timeline of Polk's major contributions at Johns Hopkins Hospital, which we're going to walk through next, starting with his work as an investigator on the study to help the AIDS research effort called SHARE. So the following year, after Frank Polk arrives at Johns Hopkins, he begins studying a small group of AIDS outpatients at the Johns Hopkins Hospital. And then in 1983 is awarded a $7 million grant from the NIH, which in today's dollars is equivalent to around $25 million to form the SHARE trial. The SHARE trial follows 1,100 asymptomatic men in Baltimore and DC to learn about AIDS's cause and risk factors. And when the SHARE trial had begun recruiting patients in 1983, just over 3,000 cases had been reported to the CDC, 40% of which had resulted in death. Researchers didn't know what its cause, and no treatment existed at this time. Frank's great insight as an investigator was based on the premise that the best way to understand this unknown disease killing young men was to follow asymptomatic men to seroconversion and then thereafter. Polk had written, "You don't know what came first, so it's important to measure and monitor these patients as time passed to determine what happened." One of his graduate students at Johns Hopkins remembers going to the NIH campus to meet with some prominent virologists about molecular aspects of his own project. The topic of Frank Polk came up, and the investigator had told Frank Polk's graduate student at that time that, this man isn't a virologist and he isn't an immunologist, but Frank seems to know better than us what needs to be done for AIDS. This is a special part of this presentation where we get to see some footage of Frank Polk himself. These were videos recorded by the Maryland Public Television Station in 1986, 2 years before Frank's death, where he was discussing his time and work at Johns Hopkins.
It was my fault, we were late.
And that is Tom
It
Quinn.
doesn't add anything, so let's not worry about it. All right. Okay. No, go ahead and roll on the white chart. I'm just gonna ask Dr. Polk a couple of general questions just to get sound levels and to get a wide shot over which to identify them. Tell me where you're from, how long you've been in Baltimore.
Well, I grew up in Texas. I've been in Baltimore about 3.5 years.
Mm-hmm. Where are you from in Texas?
San Angelo,
Where's that?
small town in West Texas.
Mm. How do you like it here?
Very much, especially this time of year.
It's terrific.
Really pretty.
What more is there that you want to tell us? You want to talk about the SHARE program a little?
I can. It's a SHARE is one of 4 federally funded projects, which was designed to define the natural history of infection. I mean, you ask a lot of questions about what are the early symptoms, how do they progress, how many progress, and so forth. Well, we have a very incomplete picture of that. And the only way to really understand the natural history of any infection is to study a cohort of individuals who are infected over time, prospectively. And that's exactly what we're doing. Combined with 3 other centers, we now have under observation 1,800 seropositive gay men that we enrolled and defined very well at baseline, and we're going to follow them up for many years to determine what proportion of those that are infected will get ARC and what proportion of those who get ARC, age-related complex, will get AIDS. We will make those estimates, better estimates of that than have ever been exist now. And furthermore, we hope to determine why it is that some individuals progress on to illness and others remain well, at least for a prolonged period of time. So those, we and obviously the NIH thinks those are invaluable studies to tell us what the ultimate size of the epidemic is going to be.
So as the SHARE trial begins to enlarge, Polk establishes the AIDS outpatient clinic in 1984 at Johns Hopkins to care for the growing number of patients with AIDS in Maryland and to support his trial. this next clip is going to be Dr. Tom Quinn discussing some of the early founding of the outpatient AIDS clinic at Johns Hopkins.
So Frank, great guy to work with, but he was sort of a bull in a china shop. I mean, once he set his mind on something, you couldn't really change it. To give you an example of that was as he formed this cohort, he said, we need clinicians to examine these people. Do they have any signs of the disease? But there was no money for clinicians to do exams on them. I mean, that the grant wasn't, it was to establish the cohort, but not to be doing examinations. And you couldn't really bill the people. So he needed volunteers. Well, Frank would go into John Bartlett, he'd go into me, he'd go into a few of the other clinicians and said, I need you to work tonight. I want you to see 20 gay men, examine them thoroughly, and put your findings down in a questionnaire that he had designed. And it was called the SHARE Clinic.
And in 1984, this outpatient AIDS clinic becomes the first AIDS clinic in the state of Maryland. It was located in the Moore Clinic in the basement of the Johns Hopkins Hospital. It was one door down from Victor McCusick's Clinic for Congenital Dwarfism. It had one exam room. And Bartlett at that time had felt that people were afraid it was going to tarnish the Hopkins name by associating it with AIDS. And in the face of that, Polk establishes this clinic, serves as its director, and recruits his colleagues to evaluate patients. And 5 years after it was established, the clinic had grown tremendously to a census of over 800 patients, averaging 450 visits a month. And from starting with a single exam room, this clinic would then grown to be known as the Bartlett Specialty Practice Clinic, with now 16,000 square feet and 24 examining rooms. So as Polk is carrying out this trial, his is recognized by the NIH as one of 4 major studies in the United States, contributing to understanding the epidemiology of AIDS. And he becomes the PI on the multi-center AIDS cohort study, which was started in 1984 and is still active to this day. SHARE joins 3 other NIH-funded research sites in Chicago, Los Angeles, and Pittsburgh to form MAX. These are nationwide longitudinal studies of HIV infection among gay and bisexual men in the United States, primarily to understand the natural history, pathogenesis, and response to treatment of HIV infection. Since inception, there have been over 7,000 study participants in the MAX trial. And today, there are currently around 2,700 participants between the 4 sites nationwide, and around 1,300 in the Baltimore site, some of who have been examined twice a year for more than 3 decades. And here's Dr. Quinn talking about Frank's great insights on the MAX trial.
But Frank was really a trained epidemiologist. And he had the vision that we'll never understand this disease if we don't form a cohort. And it's called the MAX, which is the Multi-Center AIDS Cohort Study of 5,000 gay men, healthy to begin with. And it was based in 4 cities. He was the PI. He was the mastermind of this cohort. And it got funded by the NIH because they realized there was this massive epidemic starting out. And the whole idea was to collect specimens, to interview these people every 6 months or sometimes more frequently, and see when they started to become sick and how long, what kind of diseases were they getting, what kind of response to treatment did they have or not have. And those specimens could be utilized then to try and identify the infectious pathogen, which we all knew was there. We just didn't know what it was.
So I want to use the opportunity now to pause and call out Max and Polk's contribution to it as one of the most important research trials into understanding the epidemiology of, at that point, a very unknown and undescribed illness. And this was a prospective study. This was not a randomized controlled trial. And despite that, trial design became one of the most pivotal studies to understand the epidemiology of AIDS. As Dr. Quinn had mentioned, participants who were enrolled by Polk and his team in the MAX trial are healthy men with risk factors for acquiring HIV infection who are evaluated every 6 months despite feeling well or sick, conducting in-depth interviews, physical examination, and collection of biological specimens for testing. This ends up being the longest, most rigorous, and likely the most productive epidemiologic HIV/AIDS study ever performed, to which Frank attached the motto that really for this population and for this pandemic, that good is not good enough when better is expected. At the 40th year mark of this ongoing trial in 2024, there have been over 2,000 articles that have been published from the cohort's data. And Tony Fauci, talking about Frank Polk's role in the history of understanding AIDS, had said that the MAX had really led key studies that have linked important discoveries, sexual behavior to HIV transmission, determined the median period of time between HIV infection and the onset of AIDS, had showed that an imbalance of T cell types precedes AIDS, and made a multitude of other pivotal discoveries that advance HIV/AIDS research. Here is an overview of the legacy of the MAX study, where comparing these before and after specimens and data from HIV infected and uninfected individuals had yielded a tremendous number of seminal discoveries. Not going to go through them all individually, but I think one of the most important things about this is when I and my colleagues are on the inpatient Polk service, many of these trials and the data therein are cited when we're making clinical decisions about our patients, all directly derived from the trial that Frank Polk led. Here's a clip of Frank Polk discussing one of the most important aspects to the success of the trial, which was the advisory board.
Before we initiated our study and started our recruitment, we asked for members of the gay community to form an advisory board to be advisory to us with respect to the study execution. That is, how to go out and recruit members of the community, how to be sensitive to some of their problems, how to ask questions about gay lifestyle that we didn't know that much about. And the Chair Advisory Board has been very, very helpful. Spent a lot of time working with us, and I think is largely responsible for our success. we still have over 90% follow-up 2 years into the study.
So 2 years after Frank Polk initiates the multicenter AIDS cohort study, he co-founds the AIDS inpatient unit at Johns Hopkins with John Bartlett. And the AIDS inpatient service, starting in 1986, was started in response to the fact that 50% of all hospital care for AIDS patients in Baltimore was being provided at the Johns Hopkins Hospital. And with the help of John Bartlett, establishes an inpatient service dedicated to caring for people with HIV and AIDS. This is located on the 8th floor of the Osler building and starts off as a 10-bed unit. At that time, it was the only inpatient unit in the United States with a specifically assigned house staff, and U.S. News and World Report recognizes it as the second best AIDS service in the country, to which John Bartlett had quipped that they're only one earthquake away from being number one, referring to the other AIDS service at the San Francisco General Hospital. And word catches on about what Johns Hopkins is doing. The Baltimore Gay paper gave a description of what the clinical service had looked like, which by the time of this publication in 1989, the service had grown to be a team of 27 physicians and 16 registered nurses providing direct medical and nursing care on the unit. Which was also furnished with full-time social worker, nutritionists, occupational therapists, PA, nursing assistants, psychiatrists, 2 psychologists, 3 neurologists, 2 dermatologists, as well as legal and religious counseling for patients and their families being also provided. Tom Quinn had told me that his most cherished memory as a practicing physician was when he was attending on the Polk service and co-attending with other faculty outside of the field of infectious disease who are all aligned to caring for a complex disease and complex comorbidities. There is a plaque in honor of Frank Polk located at the Joseph Ritchie House, which is now owned and operated by the larger Gilchrist Hospice Center of Baltimore. When the Joseph Ritchie House was established, it was a residential hospice in Baltimore, which had opened in 1987 with 7 beds. One of the nurses at that time, Lynn Deering, on the Osler 8 inpatient AIDS unit at Johns Hopkins, had introduced Frank to this hospice. And during the height of uncertainty and stigma of AIDS, hospice programs were not accepting these patients. And Frank had worked for months to overcome the resistance, to have the opportunity for people who were infected with HIV and who had AIDS to die with dignity. And Frank and the medical director of the Joseph Ritchie House had end up telling the governing board that all 30 of the volunteer physicians, many of whom were affiliated with Hopkins, were going to walk if people with AIDS weren't admitted to their residential hospice. And with that position, the admittance guidances were changed to now accept patients who had AIDS, and they expanded their census at the hospice to 12 beds. A nurse Deering reflected that Frank inspired so many to do the right thing. And at large, in the Baltimore community, Frank Polk was an advocate for AIDS destigmatization. He did conduct seminars for Baltimore City School principals who at the time were considering and some of whom were trying to prevent people with HIV from attending public school. He encouraged these officials to keep schools open to aged patients. He developed educational videos for Maryland Public Television. He was an early advocate of clean needle exchange programs and harm reduction for people who inject drugs, and served on scientific task forces for the state of Maryland. Here is Frank talking about the stigma of AIDS at the time.
What kind of problems do you find for AIDS victims other than the obvious problem that they have a terrible ailment?
Well, for one thing, we don't call them AIDS victims. I mean, I wouldn't say it's a cold victim or a hepatitis victim. I don't think they're victimized. I think they're just sick. So we call them AIDS patients. Well, they're obviously most of them are relatively young and they have a terminal disease, so that's not easy to deal with. Furthermore, there's a fair amount of stigmatization of this disease because of the ways in which the virus is transmitted. So there's a lot of that. Furthermore, many of our AIDS patients, I would say more than someone with breast cancer or lung cancer, also terminal or fatal illnesses, have a lot more self-guilt. They blame themselves to some degree because they got infected with the virus. Because it's caused by an infectious disease, and the lay public is not fully aware of how difficult it is to transmit it, they may have suffer some consequences with respect to where they live or where they work or where they play. So they do have more problems than patients with other terminal diseases.
That sort of thing you can hide that you.
Oh no, you can. We have a number of patients with AIDS who told other people that they have some form of cancer until the very, very end, and then at the end, it usually is difficult to hide. But for a fair number of months, it can be done.
And so as Frank Polk develops in his career, and towards the end of the towards the end of the 1980s, had also begun to expand his work to start studying AIDS transmission in heterosexual patients, people who inject drugs, recipients of screened blood products, people in prison, and as well as in pregnant mothers. Really in the late 1980s begins to enlarge his scope of his research to then involve trials internationally, and traveled to Malawi. And in 1986 was awarded a grant from the Fogarty Center to train HIV investigators from around the world at a still active research center in Malawi. And Frank was incredibly active as an investigator up until July 1987, when his life changed. He fell ill and was brought to the emergency room by friend and colleague Dr. Paul Ladenson in the Department of Endocrinology, where he was diagnosed as suffering from brain cancer. He fought his disease and underwent surgery and radiation and lost no time getting out of bed and continuing his work. His wife said that he would walk down the halls with staples in his head after his surgery. Sadly, Frank passed away in October 1988 at the age of 46 at the hospital that trained him from complications of a glioblastoma. At the time of his death, he was 13 years out of fellowship. He was director of the epidemiology program at Johns Hopkins. He was a full professor of medicine and a full professor of epidemiology. He was PI on 2 of the largest AIDS trials in the country. He is respected by his peers and beloved by his patients, friends, and family. And around the time of his obituary, Dr. Dick Chasen, who I'd seen log on to this call, had said that Frank Polk was a visionary force who brought Hopkins to fulfill a mission that others had turned away from. And John Bartlett reflected that the hospital had taken much of its early direction from Dr. Polk, and is fitting that the house he built will bear his name. Polk was destined to make an impact on medicine, and that he never tackled anything that was small, only extraordinarily diverse issues. And here is Dr. Ladenson talking about his friend and colleague, Frank Polk.
I'm Paul Ladenson, a professor of medicine in the Division of Endocrinology. And I had the good fortune to first meet Frank Polk as a Harvard medical student when in 1975, he lectured to us on sexually transmitted diseases. He made such an impression on me that 9 years later, in 1984, when I was looking at a job here in Baltimore, I recalled that Frank had not too recently moved to Baltimore himself and gave him a call out of the blue. And an hour later, found myself around the Polk's dinner table, hearing about Baltimore and Frank's experiences in his early days at Johns Hopkins. Our families soon became fast friends for all the years that followed in Frank's life. We collaborated only once scientifically with Adrian Dobbs in an early 1984 study of endocrine manifestations of disease in HIV-infected men. I think one of my fondest memories of Frank was one day when I spotted his old white pickup truck driving down Roland Avenue. And as I pulled up in back of him, I could see through the rear window, Frank driving with his left elbow out the window. And next to him, his sophisticated New York wife, Kathleen, who had slid all the way across the bench front seat to be right next to Frank. The things that I remember and admired most about Frank were his warmth, his broad circle of friends, and his integrity. I miss Frank, and every time I'm in the Nelson building, I try and take those elevators on the 4th floor where his picture is on the wall and think of him and all that for me he represented.
And Frank was a man with a wonderful family. To his wife, Kathleen, who he had met as a jar in New York, and his 2 daughters, Sarah and Genevieve Polk. Dr. Sarah Polk is a pediatrician at the Johns Hopkins Bayview campus. And one of their close friends I recalled an amusing story about one of his most memorable interactions with Frank Polk, which was on the day of his wedding, when Frank came down with the kind of GI virus that could only afflict a future ID specialist at exactly the wrong time. And recalling how all the audience there had sung an extra chorus as he ran after Frank Polk after the cake was cut, with everybody shouting, "The bride cuts the cake and the groom leaves the room." His co-resident, that Dr. Block, had said he'd had the honor of seeing Frank's bare bottom before his wife Kathleen, and injected it with enough compazine to get him on the airplane into their honeymoon destination. We're almost at the end of this presentation, and here I'm just going to share a few quotations from Frank Polk himself that capture the spirit of the kind of man he was. Frank had said to never ever write a grant for $150,000. It takes the same effort to write one for $1 million. Same review, same risk. And in talking about his research endeavors, he warned to never discuss a research project with a student until they wrote a one-page summary. Reflecting over his work, he had said that AIDS is going to be big. There are two critical parts, virology and epidemiology. But it also discussed some of the important aspects that clinician investigators had played in responding to this pandemic. Announcing once that the problem with most doctors who study public health is that they never take care of the patients with the diseases they study. Frank had a biting humor, and after discussing some confidential information about the results of the Max trial with one of his colleagues, he said, "If you tell anybody, I'll shoot you." And after expressing concern about the amount of work at hand, Frank reflected, really all you need to do is wake up 1 hour earlier every day. I'm looking at the time here. I do want to share one last video clip, which is of John Bartlett speaking about Frank in 1988 to close this presentation shortly after his death.
One of the unique features of Frank that many of you may also not realize is his tenacity for work at the bedside. It was his perception that many people who were involved in colossal research enterprises had left the bedside tragically. And he felt this was a desperate mistake. In fact, I can remember one Monday morning when he was rounding on the AIDS team, when he called two deans at this institution. They will not be named. But he said, "Dean Henderson, you work at a school where there is an enormous interest and impact on AIDS. I'll bet you've never seen a patient with it." And then he called the second dean and he said, "Dean Ross, you work at a medical school where there is an important disease that I'll bet you've never seen." To each, he said, "I'll meet you on the ward in 10 minutes. And like the obstetricians and gynecologists at the VA, they went shaking. They were there to make rounds and see their patients with AIDS. And I think it is that feature of Frank that I really found most extraordinary, this tenaciousness for his interest in the well-being of the people that we're really here to serve. He is probably unique in that if you ask Dr. Henderson, who is the best funded investigator in the last decade at the School of Hygiene, it's clearly going to be Frank. And if you ask Joan Atkinson, who is the most reliable person to show up at the AIDS clinic, it's going to be Frank. And so it is like the others with extraordinary admiration that we salute Frank, that I personally salute Frank, and recognize him for qualities that we will never be able to match. Thank you.
And in May of 1989, Frank Polk is honored after his death 1 year earlier at the age of 46 and memorialized as an extraordinary man, extraordinary physician, caring for people with HIV, and an ingenious investigator who had inspired many after him, and whose research discoveries had been so pivotal for understanding HIV and AIDS. This concludes our presentation. I want to thank everybody for their attention in listening to the life and legacy of Frank Polk.
Well, thank you so much, Dr. McLeish. That was really fantastic. Mindful of the time, although I'm also mindful of the fact that you had everybody stayed. So I will just say what a really inspiring and beautiful talk to keep us all focused on the reasons why we do this work. So thanks so much for joining us, especially post-call, and to everyone else, have a wonderful weekend. And Dr. McLeish, we hope to see you in the ID side.
Thanks everybody for tuning in and listening. I hope you all have a great Friday.